Now we'll go over a few definitions that are on your handout and give you some visual aids for those definitions. So before I begin, I want to let you know what I've done. This is my fake patient that I've already started an IV on. When you start an IV, what you have is a cannula that the needle is going through. So once you insert the needle and the cannula into the patient, the needle actually comes out. All you're left with is this flexible, pliable cannula that's left in the patient. So that is what I have here in my patient, is the cannula. So I just want to give a little background for that. The first definition on your paper is primary tubing. You have three tubing systems that can be used with an IV site. The first one is a primary tubing, second one is a secondary tubing, and then third we have the heparin lock. So I'm going to explain all three of those. So your primary tubing is the longest one. It connects to your main source of fluid. That may be normal saline, lactated ringers, or D5W dextrose. On this primary tubing, you have this end that inserts to the patient. You have ports. There could be 2 or 3 ports. This one has 3 ports where medications can be given through these ports, or the secondary tubing can be attached to these ports. And then we also have a clamp that controls how slowly or how quickly, or if you want to start or stop the fluid flow to the patient. So that is the primary tubing. It's long. It connects to our main bag. So I'm going to attach it to our patient. Make sure to keep it sterile and clean. And then you can just unclamp it and let the fluid flow through to the patient. I should have explained before you connect the tubing to the patient, you always want to make sure you prime your line. So that means getting all the air out of the line. You do that mainly just by hanging the end over a trash can or a sink and just letting some of the solution go through and get all the air out of the line. Then you'll connect it to your patient. You can allow it to flow in. You can unclamp it and allow it to flow as quickly or as slowly as you would like. So that is your primary tubing. Your secondary tubing and also your piggyback solution is described here. So here's your piggyback. Your piggyback is a solution that is in a bag, a solution or typically a medication that's in a bag much smaller than your main bag. So it's anywhere from up to 500 cc's or less. This is a 50 milliliter bag. And you hang it up beside your primary fluid, but you hang it up lower. And connected to your piggyback is your secondary tubing, which is significantly shorter than your primary tubing. And what you do is when you're going to give a medication via piggyback, you will connect it to your main line, your primary tubing. So you're going to clean off the site really well, the port, and you would connect the piggyback and the secondary tubing. In a hospital setting, you're going to have a pump that's connected to this pole, and you would just clamp in the IV line, and you would program your pump for how long you want the solution to be going into the patient, over how fast and over what period of time you want it to be going in. So that is your primary tubing, secondary tubing, and piggyback solution. The third tubing system is your heparin lock, and it would be used in a situation if you had a patient that didn't need continuous fluids, but you still needed them to have IV access. You would give them or allow them to have a heparin lock. So you would just connect it. It's a much smaller tubing. You would just connect it to the site and tape it down. And now you have access to the patient if you need it for whatever reason, to give medications through or to hook the patient back up to a primary tubing or a piggyback solution. This leads into IV push medications. So an IV push medication is any medication that can be given quickly or slowly, however long is ordered, to the patient through either the heparin lock or through the IV tubing. So through a heparin lock, this is where your sash comes into place, your saline, administer the meds, saline, heparin. So you would clean off your site really well. You would administer your saline into the heparin lock. Then you would administer your medication. And that just looks like cleaning it off and then just inserting the needle and pushing the medication in. Then you would insert your saline and then heparin. And then you would just close it back off, and you can just keep it, and you have easy access to the vein. If you want to use an IV push medication through an IV site, through an IV site where you have primary tubing, you would just connect the primary tubing up to the patient and use the port that's closest to the patient and clean off the site and insert the medication through this port. So that is your IV push medications. The last one on your page is an IV bolus, and it's just a single dose of medication that can be given to the patient. Typically, if we have a patient whose blood pressure is dropping and we need to bring up their blood pressure really quickly, we'll give them an IV bolus. So we'll say, the doctor may order, hey, give the patient a 500 milliliter bolus of normal saline, and we would just program the pump to deliver an IV bolus of 500 milliliters of solution as a single dose. So that's your IV bolus. So that is it. That's all the definitions on your handout. I hope that it was clear and made sense, and that the purpose and importance of IV medication administration was made clear as well. And good luck on your test. Thanks.